Welcome, Dr. Monty.
Hello.
How's your Thursday going?
Not bad.
Good.
Thanks for asking. Yours good?
Yeah, it's been good. I drove to Franklin for a meeting and I didn't hit any traffic, and so I'd say that's quite a miracle.
Yes, that is frankly a miracle. Any time of day these days.
Right. Hey, Lacey. While we wait to get started, if you'll chat in your favorite holiday cookie. Looks like Lacey likes a chocolate oatmeal and Tanika molasses cookie. I don't think I've had a molasses cookie. Dr. Monty, chocolate chip and M&Ms. I agree. I don't think you can beat a chocolate chip cookie. We should have what are they called, where everybody brings their own cookie and you share them. Hi, Dr. Skatsina.
Hi there. How are you?
Doing well. How are you?
I'm good.
Good. While we wait to get started, we're just chatting in our favorite cookies and getting hungry. Hi, Dr. Lister.
You guys doing today?
Hello, how are you?
Good. How are you doing?
I'm doing well. Thank you.
Good. Tanika, Mila is on board for molasses cookies. Ooh, brown butter bourbon molasses. Wow, that sounds delicious.
Okay, I'm gonna have to try that brown butter bourbon. I mean, I just love a good classic molasses cookie.
Gotta find one. Bonnie loves a Biscoff. I do love a Biscoff.
With Biscoff butter and
Ooh,
chocolate mixed on top of it, and then add Cool Whip
oh my gosh.
and the caramel sauce. Oh my gosh.
That sounds delicious. This question was not good for my sweet tooth. Mila said that sounds evil, OMG. Hi everyone, welcome. We're just chatting in our favorite holiday cookie or treat. Yes, Emily, Buckeyes, I'd say count. Um, I will not be bad if a Buckeye is in my little assorted cookie mix, so I think it counts. Just give it a minute more as people are still joining, but thank you all so much for being here. We have a great agenda scheduled for today. Welcome everyone. Thanks for joining us. For our December Best for All huddle, we're just chatting in our favorite cookies or treats.
Have you tried the Oreo, Reese's Oreos?
What is it? A Reese's Oreo?
Yes.
No, but that sounds up my alley.
My God.
I've had an Oreo dipped in peanut butter.
Yeah, no, it's so good. And
It
I've
is.
been dipping them in chocolate and decorating them today. And
Ooh.
so they're gonna be dangerous tomorrow. One
That
house
sounds
party.
delicious. All right, we will go ahead and get started. Welcome everyone to our December Best for All huddle. Thank you for joining us. As always, thank you to our operations team for our leadership and guidance. We appreciate you all. And thank you, of course, to our teams for your participation and commitment to the Best for All project and to respectful care for all patients. We've got an exciting agenda scheduled for today. First, we'll kick it off with the second video in our Minute for Improvement series on respectful conversations. Then I'll review our vital stats. We'll go through a little bit of data from this previous month. And then Bonnie is going to lead us in a IHI score QI education. And then we're going to hear from two teams who are going to be spotlit today, Maury Regional and Hardin Medical Center. And then we're looking forward to hearing from all of the teams on their leadership reports and what they've been working on these past few months. But first, we will kick it off with an opening message from our leadership. Dr. Skedzina and Dr. Lister.
Thanks, Anastasia. Hello and welcome, everyone. I'm glad you're here. I'm looking forward to hearing everyone's updates and learning more from each other. And you've already given me some great cookie ideas, so thanks.
Hi, good afternoon. We're so thankful for each of you participating and in lieu of the project that we are trying to accomplish as we kind of embark on the Christmas holiday season where we are thankful for loved ones and maybe even those that we have loved. Let's center our patients and make sure that they are able to have the best experience that they can have for their families and their loved ones. So thank you all for being here. I'm so appreciative of your effort.
Well said, Dr. Lister and Dr. Skedzina. Thank you. And now, without further ado, here is our second Minute for Improvement video. Tanika, you'll let me know if the audio is working. Now I invite you all to scan your QR code, bring out your phone and scan that QR code to take part in our Mentimeter. Thank you, Tanika. I was just trying to copy that. You can either scan it or you can click the link that Tanika just sent in the chat. I'll give you just a minute before Tanika acts as Tana White.
Love it. You ready, Anastasia? We're getting some votes rolling in. Okay.
Take it away. So the question is, have you ever noticed a coworker using harmful language when referring to a patient? So far, we have 8 yeses out of the 12 in the Menti. $11 yeses. I think it's hard because sometimes we don't even realize the language that we're using is harmful. Right, Tanika, will you go to the next one? Now the question is, why is it important to avoid using harmful language like diva or difficult? We'll give you a little bit more time on this one since it's open-ended. Someone said it affects the way we care for the patient even when we don't realize it. Absolutely. Creates a predisposition in other ways to see the patient in a certain way. Definitely. Bias, wrong impression of the patient, not respectful because it denies the patient a voice, may unintentionally hurt someone, creates a bias, places judgment on the patient and limits our ability to better understand their perspective. We're assuming something about them and knowingly speaking poorly of them. It sets up the patient for being judged before others interact. Would be very hurtful if a patient or family hears. Prejudiced, creates biased opinions. 100%, yes. Thank you all for your participation. Tanika, will you navigate to the next? And how can leaders set the tone for these conversations in ensuring that respectful care is used on each unit? Role playing. It's a great idea. Leading by example, 100%. Modeling good behavior, absolutely. Leading by example, including charge nurses. Not using that language themselves and calling it out respectively when others use it. Correcting biased language. Practice correct tone in their own interactions. It's a really good point. Being the change you want to see. Creating an honest and open forum for feedback and dialogue where it's okay to make mistakes. Absolutely. Correcting someone respectfully when they hear it. Discuss in huddles how to speak about patients and setting clear boundaries. I love it. Those are all wonderful ideas. That's perfect. Awesome. Thank you all. Oh, and highlighting language that is less than respectful when it occurs. Maybe have an inappropriate language jar so that examples can be discussed in a group setting. Wow, I love that idea. That's wonderful. These are such great ideas. And I think a lot of people don't even realize that they might be saying something that is harmful to the patient. Right, Tanika, thank you. I'm going to take it back. So we really want you guys to use those videos similarly to how we just used it now. Start having those conversations, leading those discussions, correcting the language that we often hear. We've created quite a few resources to accompany those films or those Minute for Improvement clips, so we really hope you'll take full advantage of them and start those conversations between your units, your administration, your team members to correct some of that language that we often hear and ensure that all patients are receiving respectful care. So thank you for your participation in our Mentimeter as well. Now we'll review our keys to success and vital stats. So just as a review, the keys for success in the Best for All project are measured on active participation, attending our huddles, submitting your leadership reports, scheduling your coaching calls, engaging a patient and family partner in this work. It's incredibly important for the Best for All project and all projects to gather that patient perspective and hear how these potentially better practices are seen from the patient perspective. And then, of course, implementing the different process and structure measures to improve outcomes and your PREM response rate. So for attendance on the collaborative level, we had 9 present last month, 9 teams represented. So just encourage a team member to come if you're not able to, so you can get the important announcements and educational topics. If you had to watch it after the fact, send me a note, or if you're a call-in user, let me know so that I can be sure to give your team credit. Leadership reports, we have 10 so far for November and 10 for October, with 22 teams participating. We should have a little bit more than that. It's not too late to submit them if you haven't already. We do accept those at any point in the project, so send them to me via email and we can get you caught up on your leadership reports. And then average IHI score, so this is how you all are assessing your own progress in the project. I won't get too into this as Bonnie's going to lead us in a full teaching on this later today, but just be sure to update your IHI score as you make different changes and see improvement in the project. And then our current IHI scores on the team level, we've got 2 teams reporting a 2, 5 teams reporting a 3, 1 team reporting a 4, and 1 reporting a 4.5. So we are seeing some progress. And Alicia is in Italy this week, so I am going to do my best at sharing the data. And if you have any additional questions, we can follow up with Alicia. Our overall desirable response rate for the PREM is a 93.1%. For the collaborative, this is consistent with what we've seen in previous months, and it is aligning with our project goal of 90% or greater. So great job in providing respectful care for those patients. Our overall responses, a few hospitals did increase their individual response rate this month, so way to go. Keep on keeping up the great work and implementing the PREM. We've received over 1,400 responses and are getting some really valuable feedback from the patients. Here is our update on our process and structure measures. Just as a reminder, we are hoping to hit 90 to 100% on all of these by the end of the project. And we're doing great so far. So many of them are so close to 90%, and a lot of them have already been hit. So just continuing to implement these process and structure measures and keeping them up to date in simple QI. Alicia and I are available if we can help with that. It doesn't take long, so just let us know how we can help you update your data and then keep these in mind as we're looking at the next few months. And as always, we've gotten some fabulous comments on the PREM. 62% of respondents did include a comment, which is incredible and not often seen in surveys. So here's just a few of them. Someone said, everyone I came in contact with was amazing. My labor and delivery nurses were great at listening to my wishes and wants. This was my first birth and it was an amazing experience. Everyone was so nice and friendly and answered all of my and my care partner's questions. I made the choice to change my birth plan and everyone was so supportive and helped me right away. I couldn't have asked for a better care from my care team here. We just love reading these and all the shout outs. So we hope that you guys are taking the time to look at these too, because there's some really powerful words in there from the patients. And then just a few things to work on, primarily related to facilities, but also some staff compassion comments as well. These are just as important as those shout outs. So just a few comments. Move to a transitional postpartum room. This was a little more than a closet with a shared bathroom, which was both unhygienic. There's blood on the floor and not private. I was also expected to maintain a record of my own IO. This was deeply disappointing. Another person said, my experience was good over the general stay, but a few times the nurses weren't very helpful. One time I asked if my baby's face looked a little yellow, and the nurse looked really fast, said she's fine, and moved on. I was later told she had jaundice. So just ensuring that you're taking a look at these negative and positive comments and taking the necessary steps to address them. But overall, high response rates and great feedback we're receiving from the patients. So thank you all for continuing to implement this survey. Any questions or anything else you guys would like to see next month related to the data? All right. Well, I will pass it over to Bonnie, who is going to go through our QI teaching on the IHI rating scale.
Thank you so much. So, when we're talking about TIPQC Best for All framework, we emphasize the safe, respectful care for mothers and babies, and we use standardized measures, bundles, and QI strategies to improve our outcomes, which is hypertension, hemorrhage, all of those things. So we use the IHI rating scale. Next slide, please. So when you're looking at the IHI assessment scale, we test, implement, sustain, and then spread. So testing is learn what change works. We learn how to adapt the change to make it work in our system. We implement to make the change part of our regular work system. We sustain by maintaining the change as a part of our regular work in our system. And then we spread it to test, implement, and sustain a change in order in other systems. The assessment scale uses those four core words in the improvement to describe each aspect of our improvement work. Next slide. So the Institute for Healthcare Improvement, IHI, has the assessment that ranges from 0.5 to 5 to track our progress of the improvement of our project. Next slide. So how does that work? So 0.5 is the intent to participate. The project has been identified, but the charter has not been completed, nor has the team been formed, and you haven't filled any paperwork. 1, the charter and the team is established, and a charter has been completed and reviewed. Individuals of that team have been assigned, but no work has been accomplished. A hospital, let's say, for instance, the hospital joins the TIPQC Best for All project. They form their QI team, they review current performance and create their SMART aim. So let's say they reduce severe hypertension treatment times under 30 minutes by June 2026. But no interventions have begun yet. 1.5 is planning has begun. That's you guys are working on it. And you've organized the project structure, the resources, the support that's likely needed. Where will you focus on first? The tools, materials, things that are needed, and meeting had been scheduled and developed. Next slide. And then we have 2. There's activity, but there's no changes left. So the initial cycles for the team learning have begun. Project planning, measurement, data collection, obtaining baseline data, and study of the processes and probably even a survey. So let's say the team begins a small PDSA cycle, such as test the new severe hypertension order set in 1 to 2 providers, testing Huddle during triage, testing respectful language prompts during an admission. The improvement is not yet consistent, but learning is happening. The 2.5 changes test, but no improvement. So your initial cycles for testing changes have begun, like the PDSA cycles, and then the measures are graphically displayed with target included. 3, modest improvement. Successful test of changes have begun. Let's say an order set is launched across your Wendy. Oh, second. Your nursing huddles occurs 80% of the time. Staff receive respectful care training. Data shows the process for improving, but reliability varies between shifts. The hospital is using the best for all tools, but not yet perfectly, and that's okay. Next slide. 3.5, testing and implementing continues, and additional improvement project measures towards your goal is seen. 4, significant improvement. The expected results achieved from major subsystems, implementation such as training, communication, has begun for your project. Project goals are 50% or more complete. And now the team achieves greater than 90% compliance with the new workflow, rapid treatment of severe hypertension consistently under your 30 minutes, reliable, respectful care scripting across your units, fewer delays, more predictable processes. This reflects your true system change. It also means that the team is ready to spread this improvement to related areas like maybe your postpartum unit or triage. 4.5 is sustainability improvement. Data and key measures begin to indicate sustainability of impact of changes implemented within your system. Next. And then 5, outstanding sustainable results, meaning your hospital becomes a best for all exemplar site. Performance maintained for 6+ months. Practices are spread to like your postpartum triage and women's services clinics. Improved outcomes such as fewer severe maternal morbidities. Respectful care tools such as are integrated into your EMR. And then TIPQC uses the site as a mentor or teaching hospital. The IHI score reflects that the project is no longer a project, it is a standard of care. Implementation of those cycles have been completed and all of the expectation results are accomplished, and we're so excited. When we talk about the IHI score, we're talking about how mature and reliable our improvement work is. TIPQC Best for All project helps us move from just planning a change to testing it, to implement it reliably, and then sustaining it long enough to improve outcomes. A score of 5 means that the change isn't just something we're trying, it's how we take care of our patients every day. Best for all. Next slide. When it comes to your progress of improvement from IHI, there is advisor development program where you see non-starter, established, no changes, modest improvement, significant progress, and outstanding. This is the operational definition of each score, and it is on IHI. And I think you all are doing phenomenal when it comes to taking care of our patients, our moms and babies, and progressing towards that outstanding success 5. Thank you. Next. I think that was all. Anybody have any questions at all? Sorry about my Ruppy dog. He's seen a squirrel.
Does anyone think that their score has changed after Bonnie's teaching? You can raise your
Probably
hand.
so. I really
Yeah.
think so. I think
agree.
some people are giving themselves too low of a score.
Being
But
too
they're
hard
doing
on
a really great
themselves.
job. Good job, you
Ashley.
guys.
Looks
Was
like
that
Ashley
somebody?
thinks her score might be different.
Yeah. Thank you,
Perfect.
guys.
Thanks, Bonnie. And now we will turn it over to Lacey Estes from Maury Regional to share on their work in the Best for All project and some innovative ways that they have taken on this project. Lacey?
Can you hear me?
Yes, ma'am.
All righty. So we are very excited to share the things that we have started here at Murray Regional. You can go to the next slide. One thing that Morgan Kelso, I have to give a shout out to her because as much as I would love to take credit for this, I did not do it. She is our project lead on this, and so she implemented postpartum text blast. So she was able to utilize the system that our offices use and that our inpatients use to get a text message about scheduled procedures or scheduled appointments. She was able to use that platform and use our scheduled patients. She sends a text like about their induction or about their scheduled C-section, and then she keeps that list. And 1 week postpartum, she sends a text that includes the survey link, post-birth warning signs, and a reminder for their to attend their follow-up postpartum visit if they have one scheduled. And then at week 2, she again sends the survey link. It is customized with the patient's name based on our scheduling data. And I guess you can see I created a little Canva on the right that has what she sends on that week 2 text. One thing, we recently had a team member that joined us that does speak Spanish. So one thing that she pointed out to me is that we send the text message in Spanish if that is the primary language of the patient, but it doesn't change the link for the survey to be in Spanish or the link for the post-birth warning signs to be in Spanish. So I am going to work on changing that here soon. The next slide. And the other thing that Jennifer Hardy, our educator, does is we do a weekly newsletter called the Perinatal Heartbeat for education for our entire service line. And she has done a Best for All corner. And this is just a snippet from one of those newsletters, I think it was November, with weekly shout outs for those that are recognized in the survey. So you can see on the right some of our staff members that were called out, quotes about their care, and just talking to them about our survey results. Next slide. And then something that we have done overall is each year we have to set a departmental goal, and we tend to do a service line goal for ourselves and for our staff members. And so our overall goal this year for our team was to receive gold recognition in this project. And so as we did that, we realized, well, we know exactly what it takes to be gold in that project, but what can our individual team members do? So Morgan created flyers for all 3 units. This was a mother-baby flyer, just updating what they can do to become a part of the project and to help us reach those goals. So they've become more involved now that this goal is part of their performance appraisal at the end of the year, and just really trying to get them involved in the project. Next. And then this was the overall, when we posted our goals flyer that told what they would get or what we were aiming for, gold, silver, or bronze, and how many points that is towards their goals, and then how they can help department specific as well. We are working towards trying to figure out, because currently we can only send the text blast to scheduled patients. So we're currently going to begin to work with IT on how do I figure out a way to get this to all patients, not just our scheduled patients. Leadership report basically has all of that in there. Definitely scheduling postpartum visits has been easier than we thought it was going to be. We thought that was going to be a pain point for mother-baby, but it has gone very well. And the team seems pretty excited.
Incredible work, Lacey. That is awesome. Does anyone have any questions for Lacey? Looks like Patty said, how clever to use the admission data for patient follow-up. That may help us in an upcoming newborn project. Thank you for sharing.
How do you ensure, this is Bonnie, how do you ensure that you have the correct number? Because a lot of times when we try to follow up with patients, we do not have a number that's current for them.
We have run into that somewhat. We are using the number that is in the system. The good thing about that is one of our groups is a Murray Regional group. and that's a vast majority of our patients are seen by that group. And so they fix the numbers in the office when they're not getting the text messages about their appointments and confirming their appointments a lot. But yes, we still do run into that sometimes, them not getting the text messages.
What phone are you using to send the text messages, Lacey?
It's a system. It's called Luma, and that is what the hospital uses overall for like appointment reminders.
Okay.
So it's Morgan has created a subset of patients in our scheduling book, basically, that she can send text messages to through that system.
Well, Anastasia, Brenda, Karen, what I'm thinking is, could this help us with this Born to Thrive late preterm project? So y'all help me remember all these pearls and help me remember Lacey, because we may have to call her for a consult.
Yeah, Lacey, it's fabulous. This is Brenda. We just really wanted all the hospitals to hear, because we've been sharing how y'all are doing this for this. Hopefully we'll get more responses back to our prim, but thank you for sharing that and your willingness to help us really try to access that. So I guess, Lacey, if you're willing, we may have folks that would like to reach out to you. So if you don't mind putting your email, if you're willing, in the chat, just so we can work through logistics on that. But super great job. Yeah, really appreciate y'all sharing.
Friend.
Yeah,
Morgan did most of the work on it, but I will phone a friend to get any help.
Feel free to pop her name in that chat with her email then. But yeah, thank you so much for sharing it. I really think this will be incredibly helpful to all of our hospitals. Anybody else have questions on how to access that or look at doing that at your own hospital? We think it's really great and appreciate y'all sharing that. Appreciate your innovation.
Isn't that the truth? These people are so creative in doing things. It's just amazing. I'm impressed. I'm also impressed and in awe of how everybody is so willing to share. I've said that 100 times during these TIPQC projects. I love that it doesn't matter what hospital or what hospital system you're in, you're willing to share, and I think that's amazing. So kudos to everybody for that.
That's so
Absolutely.
true.
Thanks for asking me to share.
Thank you, Lacey. And now we will turn it over to Jane Anna from Hardin Medical Center, who is going to talk about their patient engagement.
Can you hear me okay? I'm having some technical difficulties.
Yes, I can hear you.
Okay, what I'm going to talk to you about is our patient engagement with our family group. So what I have been able to do is when we have issues that have come up on the unit that normally we would kind of puzzle out ourselves and we wonder what patients were thinks, I have taken those mothers and we've got a group chat and we will send stuff and run it by them, which has been very helpful. To just get a patient perspective when sometimes we would just try to use our own perspective. And I think that's made us engage other patients more.
How often do you feel like you're reaching out to them, Jane Anna?
Since we have formed that group, it's been about once a month. So, and I mean, it's minor things. We're looking at the way our nurseries build and the way you view, whether we're to continue to have a viewing area for the nursery. And I contacted them and got their thoughts because they've just had new babies to see how they would feel if, family could not view or friends and family could not view babies. Which, and it's so just kind of some hot topics that we've had like that. So it's been very helpful. I've used it in ways that I did not expect to use the group.
That's like a parent-patient advisory council.
Yes, that's basically how I've been using it. And I will say that I happen to know these two women, so they're pretty comfortable telling me how they felt. One of them I knew better than the other one. I just kind of knew who one of them was, but the other one. So, I mean, they're both pretty blunt when we ask them, which is nice. So, it's given us
what a great way to get them invested in their community facility. That's another brilliant idea.
Yeah, As I just say, I didn't expect it to use it that way, but we have, and so it's been nice.
Can you give an example of an issue that may have come up, during the meetings and how you use this forum to effect
Well,
any
that's
measures?
what I just said. Currently, you can view newborns in our nursery. We have curtains closed most of the time, but we're looking at no longer having the ability to view newborns from the nursery. And so I've contacted them to get their feedback on that. How would you feel if your baby couldn't be viewed? So,
And so I would imagine that administration, the people who are signing the dollars or making the big decisions, to hear back from their patients on a topic like that could be quite powerful. Have you found it to be that way?
yes, ma'am, so far.
That's awesome.
Hmm.
And I think, Jane Anna, this really highlighted how like informal some of these patient and family partners counsel can be. It can be as simple as just, hey, we
Yeah,
have this idea.
and I don't think you have to have meetings every month or because I mean
Hmm.
everybody's busy. I'm busy. They have both have multiple children. So I think if you can get quick answers, get information quick, I think you can use it that way and it be of great use to you.
Yeah,
Oh.
absolutely. And then I added your leadership report here too, if you had anything else you wanted to share.
We have put our surveys on our discharge instructions, but we are still having issues. The QR code is on our discharge instructions as patients leave. I was hoping that would really increase our survey rate. It has not. So I really like this idea of sending out the surveys, the text. So I'm going to look into that. So,
Wonderful. Awesome.
thank you.
Thanks for sharing, Jane Anna.
Thank you.
All right, now Patty's gonna walk us
I feel
through
like there's something
leadership
in the pick
report.
system.
All right. Well, we've already had two great ones. That's wonderful. Can't wait to see what's next. All right, Cumberland Medical Center. Would you like to update us, please?
And Patty, she said she might not be able to make it, but she sent me an email saying that they were working with a committee to strengthen resource management across the state. They've just started, so more to come. Also, they are still seeing lack of mental health support in their area, so they've obtained a mental health first aid certificate so that she can at least talk with the ladies and get them help. And then she's also working on getting PSI certified PMHC, also forming a team that will be working toward the same. So doing some incredible work for moms and babies over at Cumberland Medical Center.
That's going to be something we're going to all want to hear about too. That's great. Thank you. All right, next, Erlanger.
Hi, everybody. This is Alicia. I just realized I forgot to add this to our report, but we're still doing our Safe Sleep Initiative with our patients. But something interesting that came up is we did have a combined meeting with our children's team, and I had updated them what I had in place for our women's services as far as labor delivery and postpartum. I had shared with them the initiative and the project I had been working on with Safe Sleep. So they actually asked if I would share the PowerPoints, all the education I've been using for the women's services staff, if I would share that with the children's educator, because they thought that that would be very helpful for that team. So I was excited to do that because they do have patients that come in with young children that they may have newborns with them or infants. So they thought it would be very important for the children's ER and pediatrics to also be educated on safe sleep, just in case they have patients that fell under that or could utilize that guidance. So I was excited to share the work that I've done with another team. So that's the main update for this month.
Yeah.
Yes, thank you.
That's huge. Congratulations.
Yeah, thank you.
All right. Morristown Hamlin. Anybody from Morristown Hamlin, are you with us?
I don't see Mandy on here. One thing I remember her saying though is that they send out thank you cards to all the patients who birthed there, and they were gonna include a little Prem survey QR code in that thank you card to hopefully increase
Oh.
their response rate.
I was just looking at her lessons learned. The staff is not comfortable asking patients to fill out a survey and provide feedback. So that's a great idea. If they're already doing those thank you cards, that's a great way to get that out as well.
Absolutely. Everybody's so innovative.
They sure are. All right, Niswanger.
Okay, hi there again. So it's Karen Scatina. So let's see, we joined the project just this summer, and then our nursing team launched the infant prim survey on our unit shortly thereafter. What we worked on this past month was training physician providers in the project and in the prim survey, and asking our faculty and residents to um, take the prim flyer out of the discharge folder during the discharge visit, and encourage moms and family members to fill that out before they go. And we've had Alicia sending us our response rate weekly since we started that effort, and have seen some improvement. Um, in discussing it with our faculty, I think one of the barriers that came up was that just the length of the survey for our patient population, they felt like that would be a big challenge. One of our faculty who was on last week, she had a couple families that while she was talking about it with the mom who had the baby, the dad was there and he pulled out his phone and started doing the survey. So just some things we've noticed so far, but I love, love, love the ideas that have been shared on the call for the sharing the prem after discharge. So we'll be sure to discuss that with our team. The other thing that we've started doing is based on input from our patient family partners and our respectful care breakfast. We decided to have a discussion of the film Forest for the Trees during a January session that will be held via Zoom. And it's going to be held as part of a regular series that we do through ETSU called the Child and Family Health Institute Collaborative Series. So it has a pretty good existing audience. We're working on getting the word out to not just providers and staff at Niswanger, but also to the other newborn nurseries in Northeast Tennessee, since it is a virtual discussion option. And of course, we are in the flyer sharing the link to, or the QR code and link to the film, and encouraging folks to view the film in advance of the session, either, with colleagues or even on their own. And we thought people may even have a little time off over the holidays, and might want to take a look if they've not seen it already. The filmmaker is actually a faculty member, a colleague here at ETSU, so we've also invited her to join the session in January. So we're excited about that. We are also working on engaging some additional patient family partners and connecting them to the Mama's Voices training. One sort of discussion we want to have in the new year is around patient experience for our Spanish speaking patient population as well. And I think those are our main updates.
Well, y'all are doing a lot of good work too.
Thanks, Patty.
Yeah, you sure are.
We found the site visit to be really helpful. So that helped us kind of solidify some plans and get some new things going. So that was super helpful for us.
Good. All right, next report. St. Francis Hospital.
I don't see Maggie or Sierra on the call.
Okay, well, we'll keep our eyes open. Maybe they'll join a little bit later, okay? St. Thomas Midtown.
Hello. Oh, let me see. Can you guys hear me?
We can hear you.
Yes.
Okay, perfect. So we are working on some changes. Last month we had one of our antepartum educators come down to Huddle and talk about doulas and significant others and their involvement in labor and how the labor and delivery nurse can really include them in labor. What they're able to do and just really encourage them to involve them in their labor process. We also added the Prem Survey QR code to our discharge class that's up on postpartum. Unfortunately, that did not seem to give us too many results back. We only got one survey back. So this month we are planning on, and we actually have already rolled out, having someone go around labor and delivery specifically and doing patient rounding for just general, overall, how are things going, but then also being able to really speak to the Prem survey. I think really what's happening is it was getting put in the postpartum folder and no one was really speaking to it, just kind of hoping that people were looking at it. So really having a nurse go be able to speak to it and hand them the QR code there and then also have it upstairs. So they're actually getting a hold of it twice. And then our patient family partner has officially completed her training. So we will be adding her to our next monthly meeting to really talk to her, let her meet all of our team members and really get her insight on things. Lessons learned really this month, we just are trying to get more conversation around the Prem surveys, just to promote completion of that.
Great, thank you. TriStar Centennial.
Hey guys, can you hear me?
Yes, we can, Ashley.
Hi, Patty.
Hey.
I have had some technical difficulties. I've gotten booted off of the call twice, so I'm glad I caught it. So we had a great coaching call, and I feel like that was kind of the highlight of our last month. I feel like it made me realize we were doing better than we thought we were, so that's huge. I would definitely change our rating scale probably to 3 at this point. And I just didn't do that. My apologies for that. We resent some of our data to our lovely TIPQC ladies to hopefully make our numbers look a little more accurate with our decreased numbers of deliveries right now. I think it was making us look like that we had less responses than we actually had. So that hopefully will transpire well. And then we're still looking forward to our change in charting system and getting to hopefully able to run more reports than we are currently able to do with our CPN charting system. So that's about it for us.
Thank you. And Vanderbilt. Anybody from Vanderbilt?
Yes, yes. We are here. Yeah, we are. I think we are marching along with our process measures, we are planning to do a respectful care grand rounds that will involve our faculty, residents, staff, and students coming up in March of 2026. We are continuing to do our PREM survey, and we are slowly getting increased engagement. We noticed that on our PREM survey, the responses from our Hispanic mothers seem to be lower than all the other demographic groups. So we have recruited 2 individuals from our Spanish-speaking population to help us get some insight. We have yet to meet with them, but we've identified people that can participate on our team. So I think that we have, gotten a lot done. I think things that next steps will be to continue our marketing, to plan a respectful care breakfast, and to just make sure that we can onboard members of our Hispanic communities to help us, realize some of the goals that we want for increasing their patient satisfaction.
Thank you, Dr. Lister. Any questions from anybody about these wonderful leadership reports and all the progress? All right, Anastasia.
Thanks, Patty, and great work to all the teams. I love hearing about the innovative approaches you're taking with this project. So incredible work. Thank you all for sharing. Now I wanted to pause and introduce Mila. She is an additional statewide patient and family partner. And so just wanted to take a minute and introduce you. Hi, Mila.
Hi, everybody. Sorry, I'm actually a business owner and chef, so I'm here at the restaurant. But I'm super excited to be here to help in any way that I can, just to make sure that everybody feels seen and heard, and most of all, just to make sure that we reduce infant mortality rates and just supporting the mothers. So, hi.
Thank you, Mila. Any reflections on the reports that you've heard today or any additional thoughts?
I just wanted to say that I thought it was absolutely beautiful to just see how everybody is working so hard for, their hospitals, and just seeing everybody's different viewpoints and the amazing things that everybody is doing. It just makes me very excited to be able to be a part of this. And, it just makes the wheels start spinning in your head. And so I love it.
Well, we are so honored to have you as a part of our team and thankful to have you. So thank you so much.
Thank you.
All right. Well, if you haven't scheduled your coaching call with us yet, we still have time on the calendar and would love to get that scheduled. Just email me your availability and we can get you on the calendar. Save the date for the TIPQC annual meeting, March 24th through 26th. Registration will launch, I believe, next week, so look for it in your inbox, but we'd love to see you there. And then our January meeting is on a different day than it normally is. It is on Monday, January the 11th. We will hear from Dr. Buddy Creech on pediatric vaccine efficacy and addressing vaccine hesitancy. We're really excited about this webinar, and so this will count as your participation for the month of January for the Best for All project, but please feel free to share this with anyone on your team that you think would benefit from this webinar. We know it's going to be a great one, and you can register by scanning that QR code or tipqc.org/events, and I will also email you the calendar invite. Any questions? All right, just a few more announcements. Homework and upcoming dates. Next huddle, January. I need to check that. The last one's at 11th. Enter your Q4 data in Simple QI if you haven't yet already, and then schedule your coaching call. And then Patty or Bonnie, did you want to make an announcement on the poster sessions and abstracts?
We want you to submit an abstract highlighting your QI work. It can be a maternal and infant, a joint maternal infant, or respectful care quality work improvement. And it doesn't have to be something that you did through TIPQC. Of course, we like those too. Abstracts are due by the 12th of January. We do have a template to help you with that. We do have a panel of experts that are going to review each of the abstracts and give you some feedback that you can incorporate when you actually create your poster. All submissions will be on the TIPQC website, and then winners will be invited to attend the in-person poster session at the annual meeting on the 25th. It's an opportunity for you all to share these great innovations. It's an opportunity for you to highlight your team and brag on them and their great work. So we hope that everyone will submit at least one, but you can submit multiple. But we hope you will submit at least one abstract and posters that highlights your wonderful quality improvement work.
Thanks, Patty. Sorry for putting you on the spot.
That's okay.
And then happy holidays and happy new year from the TIPQC team. We so appreciate each of you and your commitment to improving care for moms and babies in Tennessee. So thank you for all that you do. You're so appreciated. And then if you don't mind to take our post-huddle survey, let us know how we can improve, what other topics you'd like to see. We'd love to have your feedback, but happy holidays, everyone. Have a great rest of your Thursday.
Happy holidays.
Thanks, everybody. Great huddle. Thanks a bunch.